Since we are in the fall, we expect soon the flu season and the RSV season to hit. That usually happens between October and April. And we're also seeing a rise in the number of COVID cases in our communities. So with all that in mind, many in our communities, as well as the community of our employees here at UK King's Daughters, have reached out and asked for our lead physicians and chief medical officers to answer some questions. So I'm Charbel Salem. I'm a medical kidney specialist, and I work with Dr. Mark Detherage on population health efforts. Dr. Detherage is also the chief medical officer for outpatient services. We're joined by Dr. Stacy Caudill, who's chief medical officer over inpatient services, and Dr. Richard Ford, who's a gynecologist and chief medical officer for procedural services. Mark, we know that we have the new flu shot hopefully soon available, and we know that the influenza vaccine is something that we've been encouraging people to get for decades. So can you briefly address why it's necessary to get a new flu shot every year?
First thing, the flu shot is available now.
Right.
It's been out for a few weeks, and just in talking about that, we recommend that you take that flu shot sometime before the end of October. But the question is asked often is, why do we have to get a new shot every year? How come one shot this year doesn't completely fix it for the entire time? And there's several reasons for that. First is that sometimes our antibody response will, not sometimes, all of the time, it will reduce over time, and so we need a booster to help us help our immune system to remember, oh yeah, this is something that I need to protect against. But also every year the flu variants and the flu strains that we see may change from year over year, so the vaccine that we get hopefully is matched well against what we expect to see for this season. So those are the basic reasons.
Another very common question is, we hear from individuals who tell us that they get the flu shot and then after that they get the flu or flu-like symptoms. Can you talk about this concern and why it's unlikely that you actually get the flu after you take the flu shot?
We do hear that a lot, and I think there's a few things to say about that. The first is that the flu shots that we give do not contain active flu virus, and so you can't get the flu from the shot at all. The second thing I always tell patients is that we tend to give the flu shots a lot of times during flu season, and so there is a chance that you may be incubating flu virus in your system already, having picked it up from somewhere else, and it just so happens that you're going to get the flu whether you had the shot or not. And then the third thing is that you do have the potential to have some mild side effects from vaccines, like some achiness and soreness and things that oftentimes we associate with the flu, but usually with the vaccine it's just going to last a few hours, if not the better part of a day.
I think just one thing to remember here is that, as you said, the flu shot is again an inactive vaccine. So, but for the pediatric population, for the kids, it is recommended that kids until the age of 9 get the flu shot in 2 consecutive doses at least once. Usually this is done prior to the age of 2, and then after that initial 2 consecutive shots are done, typically annual flu shot vaccination is recommended for the kids. Another thing we hear from the community is side effects after the flu shot, and they feel sick after that. So what are the common side effects that we see with this vaccine, and are there a group of people who are more prone to these side effects than others?
So I mentioned earlier that the main side effects you expect to see, if any at all, most folks have none. You can have some soreness at the injection site, low-grade temperature, some chills, maybe some general aches, but it doesn't last very long, and they're usually very mild and treatable with really nothing or some Tylenol.
Last question that's on everyone's mind, and that's the coverage by insurance. Do we know if this vaccine is covered by the typical payers usually?
The payers will cover the flu vaccine, and one big question that we get is, will Medicare cover it? And the answer is yes. Medicare has traditionally covered it. if you are have a child and the child is on Medicaid, Medicaid requires that those vaccines be given to be covered, to be given in the pediatrician's office.
I think it's important also to remember that last year the flu shot that we received was effective in decreasing the risk of hospitalization by about 70 to 80%. I'm going to move over to Dr. Stacy Caudill, who is one of our hospitalists and Chief Medical Officer for Inpatient Services again. So I know this is an area you're very interested in. Can you tell us a little bit about what's different about this new booster that the FDA just approved specifically for the COVID vaccine?
Just this past week, the FDA approved a new COVID vaccine. This is, in fact, the only COVID vaccine that is going to be available in this fall. It's based on the circulating variant that's out right now called XBB.1.5, which really is only important because it has a bunch of mutations that evade vaccine immunity. So although our previous vaccines may have some immunity towards it, this one would have a lot more.
We know that there is a very small percentage of the U.S. population that has not received the primary series, which was done during the pandemic. So 70 to 80% of the U.S. population has received the primary series of the vaccine. But for those who have not yet, the newer vaccine, when it becomes available, can become the primary series for you. So if you have never received the COVID vaccine, you can still receive a primary series. But if you're immunocompromised, there are specific caveats, and in those specific instances, if you're immunocompromised and are wanting the COVID vaccine, please ask your primary care provider or indicate that to the vaccination center or the pharmacy, wherever you're getting the vaccine at. So specifically though today, Dr. Caudill, for those who were vaccinated before, who should get this new vaccine, and are there special populations who should definitely make the effort to get it?
So the updated COVID vaccine is approved for all of those 5 years and up as a one-time dose. And then individuals in high-risk groups may receive additional doses, as you kind of just mentioned. For those people considered at high risk of severe illness, the CDC has updated this list. It's very similar to all of the conversations we've had in the past. So age greater than 65, there's a significant increase in risk of death, risk of hospitalization once you get over the age of 65. Chronic lung disease such as COPD or asthma, end-stage renal disease, dialysis patients, cardiovascular disease, so those patients with a history of coronary artery disease or strokes, chronic liver disease, so cirrhotic patients or NASH patients, diabetes, obesity, and as you mentioned before, immunocompromised patients.
Another very frequent question is if someone had COVID once or multiple times before, and they've had the vaccine or not before, should they still get vaccinated with the new vaccine?
If you look at the CDC site, you can wait up to about 3 months if you've had recent COVID. So the reason that that is important is because then you would have had exposure to this current variant that's now circulating. So they say that you can wait up to 3 months. However, if you're in that high risk class of developing severe illness or increased mortality, then they recommend that you go ahead and get it as soon as possible and have that conversation with your primary care doc.
And I know you have taken care and seen COVID patients in the hospital. So tell us a little bit more about the protection that the vaccine provides against developing severe COVID.
Yeah, I think it's important to understand that the vaccine doesn't necessarily prevent you from getting COVID. Mm-hmm. The purpose of the vaccine is to protect you from getting serious complications from COVID. There's shown a significant decrease in hospitalizations as well as death with people that have been vaccinated. It also recently came out that there's a significant reduction in those patients getting long COVID. So I think that that is an incentive for lots of people as well.
With the new vaccine right now and the fact that it's not really covered by the government programs that were available for us during the pandemic, there's a couple questions that the community has. One, do we need an order to get the vaccine? And two, where can we get it? Three, are the payers paying for it, the insurances?
So as you mentioned, with the end of the public health emergency, it is not free any longer to get the COVID vaccine, although most insurances are covering the vaccine. You do not require an order, and we are going to try to offer the COVID vaccination through our drive-through.
Dr. Ford, specifically for pregnant women considering either the flu or COVID vaccines, are there any considerations or concerns specific for that population? And it is recommended to get these two vaccines during pregnancy.
I think the short answer to your question is no. There are no real contraindications to being vaccinated during pregnancy. Probably the better question would be, what are the benefits of being vaccinated during pregnancy? And for the flu and for COVID, we know that your risk of hospitalization is greater if you're pregnant and you contract either the flu or COVID. And we know that vaccination with either of those vaccines will reduce your risk of severe illness or hospitalization. You know, the initial FDA approval for the COVID vaccine did not include pregnant women for the very simple reason that pregnant women were not included in a study to evaluate the vaccine. Since that time, we have data on over 8 million pregnant women who received the vaccine, and the outcomes are actually better for women who received the vaccine than women who did not in terms of prematurity, reduced risk of prematurity in women who are vaccinated compared to women who are not. There is no increased risk of stillbirth in women who have had the vaccine compared to women who have not. And there is actually a reduced risk of cesarean section for non-reassuring fetal heart rate tracings during labor. So one of the thoughts is that we may see positives from the vaccine by preventing clotting in the placenta from COVID pregnancies or COVID infections that might occur during pregnancy.
There's a question that is common in the community, and we just want, it's outside of the seasonal and the viral illnesses, but specific to the TDAP vaccine. So why should women consider getting the TDAP vaccine, and also what does it entail for the rest of the household?
One of the things that we were hoping to put forth as an advantage of vaccination in pregnancy or prior to pregnancy is the bestowment of passive immunity for the newborn. Newborns obviously haven't been exposed to a lot yet, and by passing those antibodies through the placenta to the newborn or to the fetus, that newborn then has some immunity that lasts for several weeks to a few months after delivery. So if a mother is up to date on her TDAP before she gets pregnant, then she'll pass those antibodies on to that child after delivery. And if the surrounding family members, all the big brothers and big sisters who want to love on their little brother or little sister, if they've all been vaccinated, then we reduce the risk of infecting that newborn with a serious infection.
Shifting gears here, RSV, some exciting news. There's 2 products that are available now. So one of them is actually a monoclonal antibody, not a vaccine. It's a form of passive immunity that will become available soon for children younger than 8 months. It's called nirsevimab, and it will be recommended for children in their first 8 months of life. And there are some infants who would actually qualify for a second dose of this monoclonal antibody up till the age of 19 months, depending on whether they have some chronic cardiac and lung and neurological and other conditions. So parents, please ask your pediatrician specifically about nirsevimab. But back to you, Mark. We know that there is now an RSV vaccine that will soon become available for the elderly population or people over the age of 60. And so what do we know about this new vaccine, and what are the recommendations that we know of right now?
RSV is something, respiratory syncytial virus is what that stands for. It's something that we have traditionally thought of as an illness that only happens in young kids, because we know that when the young kids get it, they can get very, very ill. And I'm glad that we have this new product out for the young ones. But it is also a virus that can affect all of us, and it does affect all of us. Those individuals who are over 60 years of age tend to be at higher risk for developing severe illness. And the time frame of getting the RSV is similar to the flu, and similar in that it is around October to March or April. So for years we've been searching for, Dr. Ford and I were just talking about this, searching for an RSV vaccine, and now we have it. And as we talk today, it's only been a couple of weeks since we've seen the process of approval go through, and it's so early that we haven't even yet received some of the vaccine here. But the recommendation is for anyone over the age of 60 to at least consult with their physician and talk about whether or not it's appropriate to take the RSV vaccine. It's usually one dose. That's what's being recommended, and then as we move forward, we'll determine whether a booster is needed next year or not.
So we touched on who should really take this vaccine. One question, again, to clarify, and then the other one is, can you take the RSV vaccine when it becomes available with the flu shot and the COVID vaccine together?
The short answer is yes. Those all three can be taken together, and a lot of times it's most convenient to do that. Again, if there are some questions about it, don't hesitate to, I always tell folks, don't hesitate to ask me, ask your provider, and get those things answered.
And as far as we know, at least for now, and again, it's going to be a learning curve. This is going to be one of those vaccines that you would need an order from your provider initially, at least in the initial phase of launching it.
Yeah, right now, that is the case. There would be an order that would have to be in place to get it through our office or through a pharmacy.
Excellent. So thank you, Mark. Now we know that there is already an RSV vaccine already available right now, and but the cost has been an issue, and it has been approved actually for the pediatric age group, but also for pregnant women. So Richard, can you please give us some more details on that?
So a study that was released back in April in the New England Journal of Medicine looked at the vaccination of pregnant women and the outcomes for newborns. So the vaccination was given, the very first prospective randomized trial of the vaccine was over 7,000 pregnant women, equally divided with placebo and our RSV vaccine. And we looked at the outcomes in both those groups, and what we found is that there was a dramatic reduction in the risk of newborn infections that required medical attention from RSV. So we also saw a reduced risk of death in that same group, a greater than 50% reduction in newborn mortality from RSV in women who've been vaccinated versus those who had not. All that said, without increasing the risk of prematurity from premature labor, without increasing the risk of bad outcomes such as stillbirth or low APGAR scores at the time of delivery or complications for the mother. So I think the vaccine demonstrated its efficacy in pregnant women, but even more important, it's demonstrated its safety for the mother and the fetus, and protecting that baby after delivery is probably our most vulnerable group that we have, honestly.
Thank you, everyone. This concludes our roundtable today, where we answered questions related to seasonal viruses, some about TDAP. We know that there are other questions about pneumonia vaccine, shingles, and HPV from the community, and hopefully we'll organize another roundtable in the future to address those. Thank you very much.